Muskegon Rotary. This is Nancy Crandall. I'm here today to introduce our program, and we have three distinguished people who will serve on a panel today from Mercy Health Muskegon. Gary Allure, who is the president of Mercy Health Muskegon, Dr. Justin Grill, who is the chief medical officer, and Kim McGuire, who is Vice President of Patient Care Services and Chief Nursing Officer. Welcome to all of you. We are happy to have you with us at Rotary today. And I will start with asking Gary to briefly describe the current state of Mercy Health Muskegon.
Well, thanks, Nancy. Nice talking to you. I would, from a current state perspective, I think Mercy Health it's been a whirlwind the last 6 months. There's no question. Busiest 6 month in my 32-year career in healthcare administration, and we went through a new electronic health record install in January, which we're still in the process of optimizing right now. And then certainly the COVID pandemic hit us in mid-March, and it's been a whirlwind ever since. I feel like we've gotten to a point where we're very stabilized. We got ourselves prepared for any surge that might happen from a staffing and a facilities perspective. And I think we did a good job for this community, really shutting down ambulatory and elective kinds of procedures so that if we did have a surge, we would be prepared. We certainly were fortunate because our community did a nice job in keeping people home and safe, and we never had a significant surge. So as of about mid-May, we really have started to try to ramp back up to normal. If normal is even possible these days, we're trying to ramp back up to a point where our community is feeling safe coming back into the hospital and getting the appropriate services they need. So that's going on today. As of the last couple of weeks, we're back to running about 90 to 95% of where our volumes were pre-COVID. So the business has been coming back. We had a really difficult 2 or 3 months financially. And from a colleague perspective, we did have to go through a significant number of furloughs to try to adjust for where the volumes were. So it's been a tough few months, but our colleagues and our leaders and our medical staff has been just absolutely amazing. I think our mission of serving together in the spirit of the gospel as a compassionate, transforming, healing presence was alive and well the last 6 months. And I feel like we are definitely coming out of this pandemic, and we're set up for a very successful future, which I'm sure we can talk a little bit more about.
That's terrific. It's good news for the whole community. Where are you now with the building project? I see the wonderful picture behind you of the new building, but with the renovation of the old building.
Yes, that's what I was hoping we'd be able to spend some time. So as we're trying to emerge out of this COVID pandemic, we're going to be announcing internally today. We just had a friends and supporters town hall. We did pick a final date when we're going to consolidate. So October 12th through the 18th is when we will begin to move all of the patients and colleagues. There's about 1,600 colleagues that work at Hackley Hospital, and obviously at any given day there's 100 to 125 patients that are inpatients at Hackley Hospital. That move is going to happen October 12th through the 18th, and we are just excited to be able to finally get our entire community together and our organization together in a state-of-the-art facility with private rooms. So that's moving ahead, and you're going to start to see some communication. So we'll be communicating internally. We will start to communicate on the Hackley campus, Mercy campus, and throughout the community, so people know when the transition is going to happen. And at that time, as you've probably heard before, we plan to still have urgent care on the Hackley campus, but it won't be a full 24-hour emergency service. So we will be doing that communication, but our Mercy ER has 54 beds and will be ready to roll from an ER perspective. So that's exciting news. The other facility that's still moving forward, any of you that live in Norton Shores have probably seen the activity happening. Fortunately, construction work in medical was considered an essential service. So the construction of the medical center completion and Norton Shores is moving ahead in great shape. Looks like the date of January of 21 is when we're going to come together in the Norton Shores office, which will consolidate Norton Family, Harbor Point, and Harbor Wood practices today. So that's going to be a great new state-of-the-art facility. So we're going to have a couple-year-old big ambulatory site in North Muskegon. We'll have the same in Norton Shores, and obviously our new medical center. We are set up in a really good place for this community. Got a lot of work to do to make that transition happen, but we're doing good work, and things are moving along.
That's terrific. You are doing good work. Speaking of good work, tell us a little about where we are with the COVID-19 situation now.
I will give a little update, and then I will certainly let Dr. Grill talk about it as well. He just did an update for the friends and supporters on the town hall. So as I mentioned, I'll just kind of go back as we prepared for a surge that we are expecting could happen in the March and April timeframe. We got to a peak in our organization where I think our highest was in the low 30s. So we had at any given time the highest number of inpatient COVID positive patients was low to mid 30s. For the last 3 or 4 weeks, we've been down to running anywhere between 1 and probably 11. So we've seen that really come down. Testing continues to be strong, but as far as hospitalizations, that number has been going down across the state. And in Muskegon, we're at a point where we can handle the capacity of COVID volume right now, but we are continue to watch things though, and we're ready if a surge happens again. I think I would ask Dr. Grill if he has anything to add.
Gary did a very nice job in detailing the situation. Maybe the one thing that he didn't touch on is deaths, and the deaths we've also seen tail off. I think in the last week or so, we've only had maybe one here locally, which is fantastic. We've had a number of days consecutively with 0, and that's also true in the state. In fact, statewide on Monday, there were no deaths in the prior 24-hour period from COVID, which is fantastic. It's the first time that that's happened for quite some time. So admissions seem to be decreasing, deaths seem to be decreasing, but diagnosed cases are increasing. Fortunately, right now, it tends to be in lower risk, younger populations, but we're watching that closely to ensure that it doesn't end up spreading to more at-risk populations.
And what is Mercy Health doing to keep patients, both inpatient and outpatient, staff, visitors, all these folks safe?
Well, I'd like to tackle that one, if I may, Nancy.
Yes.
I am proud to share what we've been doing. Obviously, the patients, the staff, community safety is our top priority, and we've been doing a lot of things here. We've been staying very connected to the CDC as well as Trinity. We have many incident command calls where we learn and keep up to date on the latest governor executive orders and so on and so forth. But some of the things that we've been doing specifically is we are screening all our employees every day when they come in for symptoms and temperatures, as well as visitors. So everyone has to answer a series of questions and have their temperature taken, and then based on outcomes are treated appropriately. We also test all of our patients that are coming in. Every patient that is admitted has a COVID test, so we know whether COVID positive or not. We have a dedicated COVID unit where we place our patients that are positive, and then we have our COVID-free zones where we take care of patients that are not COVID patients. And so we try to separate the two. We have dedicated COVID staff as well. So we have staff that specifically work on the COVID unit and don't cross over into the non-COVID or COVID-free zones. We do require a mask in the hospital, both for staff and for visitors and administration. I just took my mask off, by the way. And we've just added goggles or eye protection for all caregivers here, whether they're caring for COVID patients or non-COVID patients. We're obviously encouraging social distancing in our halls, our elevators, our common areas, and limited visitation, of course, is another result of our pandemic. And so in relation to that, though, we try to encourage video visits so that folks can stay connected to their loved ones, families and friends. We've also encouraged e-registration. So if you do have to come into the hospital for a procedure, you can spend time at home registering so you have less time face-to-face with the registration clerk. We have obviously plexiglass barriers up between our registration folks and front-facing folks and visitors and patients, and then obviously enhanced cleaning. Our housekeeping staff do an amazing job anyway, and they're doing an extraordinary job in this pandemic as well. And so we've increased our frequency of cleaning, and obviously use the detergents and cleaning solutions that's recommended by the CDC. And then we have hand sanitizer everywhere. So we encourage obviously hand washing and have hand sanitizer available. And then encouraging virtual visits. This is a great time to learn how to do virtual visits with your primary care physicians, and a lot of people are taking advantage of that. So a lot of activity, and it's a very safe environment to come to, and we encourage the community to seek the healthcare that they need and not wait. Come in and get your care because you're very safe here in the hospital.
Oh, that was a really thorough description. Thank you. What about access to primary, specialty, urgent, and emergency care during this time?
Well, I'll jump in on that one and let Justin or Kim jump in. So we did, for a period of time, as we were trying to keep people home and safe, we had closed a significant number of our offices across the community, and we were doing up to 30 to 40% of our visits were virtual for a while. But now I think from an access perspective, we had quite a few people on furlough during that time where we had closed some offices. But now our offices are back open. We're calling back virtually everyone on furlough in the ambulatory sites. And I think from a primary care and a specialty practice perspective, we are back open and trying to encourage people to get back in. We've got precautions in place, as Kim talked a lot about, to make it safe for people to come back in. And we are absolutely encouraging people to get back into the system for care. And we're seeing that. We're seeing just in the last month, roughly, in our physician offices, we've been running between 90 and 95% of our pre-COVID volume. So things are coming back and offices are open.
All right.
And I would say from an emergency.
Yes.
I'll say from an emergency department perspective, as Kim noted, we have, for inpatients, a dedicated COVID unit. We have that in our emergency department as well. I continue to practice emergency medicine, which is my specialty, and we're still seeing people coming in with very advanced disease states from not accessing emergency care when they need it. So just as it's safe to access the primary care network, it's safe to access the hospital. It's also safe to access our emergency department. We cohort any suspected COVID patient in a particular pod. In the Mercy Emergency Department, we have a dedicated area in the Hackley Emergency Department so that those patients aren't cohorted with the general population. So if people need to access emergency care, we would also encourage them to do that. We have it set up. It's safe just like with inpatient care with primary care.
That's so important for the community to know. Speaking of that, what recommendations do you make to keep people safe and people and their families and the folks they associate with?
There's a number of simple things that people can do really to keep themselves safe, and it begins with masking. And I know there's a huge controversy within society right now as far as should you wear a mask, should you not wear a mask, and it really is a pretty simple calculus in my mind. Even if you assume that if you wear a mask, you decrease your own spread by 80%, if we make the math easy and we say, hey, every time you cough, you spread, let's say, 10 droplets of whatever infectious process you have going on, that means 8 of the 10 don't go out. I hear a lot of people say, well, if I wear a mask, it doesn't really protect me. Maybe it's only 50% protective. And if we say, okay, let's assume that math is correct. If someone else coughed and their mask held in 8 of the 10 and your mask holds in 1 of those 2, then only 1 of the 10 droplets that they coughed out is actually even able to get to you. So you have a 90% reduction in your risk of being infected just by 2 people wearing a simple mask. And that's all it really takes. So we're really encouraging people to wear masks to reduce their risk profile. Kim talked about how much hand sanitizer and opportunities for hand hygiene we have around the hospital, and we suggest that as well, that if you're going to go out and about, if you go grocery shopping, for instance, wear your mask when you go into the store. When you're done grocery shopping, just use some hand sanitizer, clean your hands off. That reduces the risk of spread. But if you touch something and you're exposed to it and then you rub your eyes or something like that, you're potentially going to infect yourself. So the use of hand sanitizer reduces that risk. And then, of course, physical distancing from other people greater than 6 feet away significantly also reduces your risk. So those three things alone can greatly minimize the risk of either you transmitting the virus or obtaining the virus from someone else.
People seem to be moving around a lot more recently than they were initially. Do you have suggestions for what to do or not to do in terms of exposure for anyone?
My advice to that usually depends on your risk profile. So everyone's got to go to the grocery store. You have to get groceries. You've got to fill your car up with gas periodically. And the three things that I talked about before are certainly things that anyone can do when they have to participate in whatever activity of life that may include exposure to people who you don't know and may be at risk of transmitting COVID. But there are a lot of people who are starting to go on little vacations again. You see a lot more travel, let's say, within the state of Michigan rather than flying to Hawaii or something like that. And what I usually say is if you're a high-risk person, if you're over the age of 65, if you have medical comorbidities like kidney disease or diabetes or high blood pressure, heart disease, that we know put you at an increased risk, this probably isn't the best time to be traveling. It would be better to stay around home and only have contact with people within your inner circle. But if you do choose to travel, I would definitely follow the lines that I suggested before with masking, physical distancing, and hand hygiene.
Okay, thanks. Gary, you mentioned the furloughing of employees during that early part of this. Are you anticipating hiring everyone back or a percentage of those?
No, and many have come back, but no, we do not plan to bring everyone back as we're looking at our future volumes and trying to get from pretty significant losses financially in the last few months back to a break-even level and then moving forward. We are definitely going to have to reduce the number of colleagues that we have in the organization to match the reductions in volume that we've seen. And the cost of care has gone up a little bit too, just because of all the precaution we have to take related to PPEs and distancing and those kind of things. So a good majority of the colleagues have come back from furlough, but we're looking at a variety of different things, including some transitions to set our organization up for a stable and secure future. So it's been a difficult time going through the COVID pandemic and now trying to adjust our cost to where we think our volumes are going to be. It's been very difficult, but we are getting towards the end of that process and moving forward and looking out to a bright future and new facilities with some great colleague engagement and patient experience.
And when the new facilities are open fully by the end of the year, and including the Norton facility, do you anticipating hiring a number of people?
No, actually, I would say that we're because what we're doing is we've had older facilities where these practices have been physically at. So we're really consolidating some of our practices into the new North Shores facility. We are looking to potentially hire a few new providers. And if that does happen, we'll have the staff to support those providers. In the medical center, it's really just more of moving from one location to another. So it's going to allow us to be more efficient in the new medical center and obviously have facilities that are state of the art compared to some of the older facilities that we were in.
And I recall that you had tours of the new hospital before it opened. You had invited a number of people and the public to come in and see the hospital. Will you be doing that same thing at the Norton building?
Yes, we will definitely have some open houses for the Norton building. It'll be difficult now that we're operating the medical center, but we'll try to work through that. But yes, for the Norton facility, we will definitely have a few open houses for the community.
Good. That's good news. We are closing in on our time frame here, but we have a few more minutes. Is there anything else you'd like to add, any of the three of you?
Well, one thing I would like to just add is that I am very grateful to live in this community. I have lived here all my life, and the support that the community's given the healthcare system and Trinity as well. I have to give a shout out to Trinity, but I would really encourage the community to continue to seek healthcare as they need it. Dr. Grill talked a little bit about people waiting for care, and I want to assure people you're very safe here in the hospital, you're safe in the offices. We've taken the measures that we need to and encourage everybody to seek the care that they need.
An important message. Dr. Grill, you look like you were ready to say something.
I was actually going to say the exact same thing. She took the words right out of my mouth. Just an immense sense of gratitude to our community, emphasizing that it's safe to access care here. And then just one question we've been receiving a lot recently is in regards to testing, and there doesn't seem to be enough testing in our community. And just to let everyone on Rotary know, we're exploring the options to increase community testing. We don't have anything that we can publicly announce right now, but I think in the very near future, we'll be able to come up with a plan to broadly increase testing, both for symptomatic and asymptomatic patients in our community.
That's great news.
And
Gary?
all I would add, Nancy, is just to say thank you to our business community. The trust and confidence that you've placed on our organization is noticed, and the support that you've given us, both financially and physically, has been very well noticed. It's great to see as our heroes in healthcare working 24/7. Our community is supporting them, and they appreciate it, and we've seen it. So thank you all.
Well, thank you very much, all three of you. This has been very helpful to us. We've been having at our Rotary meetings each week an update from Kathy Moore, the Public Health Director. So we're keeping up to speed on what's happening in the community. But this has been a good addition to our information. And I understand that you will be available to respond to some questions after the presentation. So again, thank you very much for being here, all of you.